Please mention in the chat box. So in today's class, we'll do on vitamin D, chapter on vitamin D. About vitamin E and K, I'll give you a small assignment. Okay. And about vitamin D, we'll take it in detail. Those who are joining late, please help them out with the page numbers. It's on page number 318. Those who have the textbook, 318, chapter 17. If anyone is joining late, please help them out with the page numbers. So vitamin D, it's a fat-soluble vitamin and it exists in two forms. One is vitamin D3, that is called a calciferol, and then vitamin D2, that is ergocalciferol. Okay. Inactive form, it is available in inactive form in plant molecules. Okay. But the active form of vitamin D is only available from animal products. Okay. So the precursors of vitamin D are found in animals, that is called cholecalciferol, and in plants it is called ergosterol. So ergocalciferol has to be converted into vitamin D3. Only then it can be absorbed into the system. Okay. But the inactive form of vitamin D available in the plants is not suitable for human absorption and consumption. Okay, it will more or less help the animals who are herbivorous. The active form of vitamin D is calcitrol. Okay, it is called as a hormone. It is calcitrol is 125D hydroxy vitamin D. Okay, it acts like a hormone because it sends message to intestine and other body parts as well for its own function. But for intestine, the vitamin D, the active form of vitamin D, will send the message to intestine to absorb more calcium and phosphorus. Okay, since vitamin D has this action of directing another organ to do a function. So that is how a hormone functions within your body. Okay. Hormones basically are produced somewhere, produced in a gland, but then when they are released into the bloodstream, they send messages to specific organs to do a specific action. So vitamin D in the form of calcitriol is also doing the same thing within your body. Okay. It is getting synthesized in your skin, okay, under your skin, and in its active form it is able to guide the intestines to absorb more calcium or phosphorus. Okay, that is a function of vitamin D. So vitamin D3 is cholecalciferol, found in animal products, is 3 times more potent than vitamin D2. Okay, that is the reason why the plant-based vitamin D2 is not at all potent, or it is invaluable when it comes to human consumption. It's only the vitamin D3, cholecalciferol form, which comes from animal products, which can be used by humans. So in humans, sunlight will not give you vitamin D. Okay, that is a myth. Sunlight means what? It's just ultraviolet radiations, infrared radiations, okay, UVA, UVB, infrared rays. This is what sunlight is. It does not have vitamin D. But your skin, when the sunlight touches the ultraviolet rays, when they touch your skin, it will initiate the conversion of vitamin D into its active form. Okay, so the inactive form of vitamin D is already present under your skin. It just requires activation, the photo conversion and activation because of the presence of sunlight. Okay, sunlight will not give you vitamin D. Sunlight can only activate the conversion of provitamin D3, okay, into a pre-vitamin D3. So in your skin, vitamin D3 is formed provitamin D3, which cannot be utilized. Okay, it has to be converted. Provitamin D3 is 7-dehydrocholesterol. 7-dehydrocholesterol is your provitamin D3. It has to be converted into pre-vitamin D3, that is cholecalciferol. Only then, when this conversion takes place because of the presence of sunlight, when the conversion takes place, only then vitamin D3 can be stored in your liver. It can be utilized by various parts of your body. Okay, majorly it is stored in the liver. It's a fat soluble vitamin. It is stored in the liver. Okay, and also dietary intake of vitamin D3 from non-vegetarian food, dairy products, and D2 through supplements. Vitamin D2 comes through supplements. Okay, vitamin D2 has to undergo a lot of conversion to be suitable for to be converted into vitamin D3 and be stored in the body. Okay. So when in the liver, because of certain enzymatic actions, okay, when the liver decides that vitamin D3 has to be released from the body, released from the liver, it has to be released into the bloodstream. It releases vitamin D3 in the form of 25-hydroxy vitamin D3, which means it has around 25 carbon compound, and on the 25th carbon compound, there is a hydroxy group. Okay, that's why this name has come. 125 hydroxy or 25 hydroxy in 25th carbon atom, you have the hydroxy group. Okay, that is the reason why it has been named 25 hydroxy vitamin D3. And after the liver, it goes into the, as soon as it reaches kidney, it undergoes another conversion. Okay, one more hydroxy group the kidneys will add into the carbon structure. So on the first carbon atom and on the 25th carbon atom, okay, hydroxy group will be added. Hydroxy group means OH. Okay, OH group will be added. So 125 dihydroxy vitamin D. Dihydroxy means two hydroxy groups are there. One is on the first carbon atom. The second one is on the 25th carbon atom. Okay, so 125 dihydroxy vitamin D3 is in a hormonal state. Okay, up till 25 hydroxy vitamin D3, it is not in a hormonal state. It is still in an active form in which it can help the body do major transformations. But when it comes to 125 dihydroxy vitamin D3, okay, that is the form in which vitamin D will act as a hormone. Okay, in this form, it is able to maintain the calcium balance in the body. It means kidneys are also able to maintain the calcium balance in the body because kidneys are secreting this form of vitamin D, 125 dihydroxy vitamin D3. Okay. So is it clear to all how the vitamin D synthesis takes place within the body? How the sun enables sunlight, ultraviolet radiation specifically, ultraviolet radiation will enable the conversion of inactive form of vitamin D in the, it is like cholesterol. Cholesterol is found under the skin. Okay. Inactive form of vitamin D is converted into an active form of cholecalciferol. Even in animals, the same situation takes place. Just like in humans, we have this conversion of dehydrocholesterol is converted into cholecalciferol. In animals also, the same conversion is taking place under sunlight. Okay, that's the reason why we get this vitamin D3 from animals as well. The same vitamin D3 which is present in our body after conversion, the same vitamin D3, the same active form of vitamin D3 we get from animal sources. But this conversion does not take place in plant sources. Okay, so that's why it is vitamin D2. Okay, it will be stored in the liver. From the liver, it will get an hydroxy atom attached because of liver enzymes. Okay, hydroxy atom will be attached to it. the 25th carbon atom. So we have 25 dihydroxy vitamin D3. It goes to the kidney. It will collect one more hydroxy atom on the carbon structure. So 125 dihydroxy vitamin D3. This is the hormonal form of vitamin D3. Is it clear to all? Coming to the functions of vitamin D, it helps form and keep the strong bones and teeth because of its responsibility of controlling the calcium content within the body, as well as vitamin D3 or D3 also strengthens your bones and teeth in general. It helps the muscles to contract. It helps the nerve system to carry messages within the brain and body, supports your immune system. These are one of the few functions of vitamin D. The main function is calcium homeostasis and bone formation and bone maintenance. This is why it is important for children, growing children, to go out and play in sunlight. Okay, kids should go out and play in sunlight. They should get the sunlight because only then it could lead to strong bones, teeth, healthy bones and teeth, and healthy bone formation. Okay. Yes, 7-dehydrocholesterol form is present right under your skin. Okay, in the dermis layer. And also the mineralization and formation of newborn, vitamin D plays an important role. If you do not have enough amount of vitamin D in your body, it can lead to hypocalcemia as well. Vitamin D deficiency can lead to rickets, osteomalacia, and hypocalcemia, very less amount of calcium in your body. Since calcium is required as well as vitamin D is required for your contraction of muscles, if there is any abnormalities in the content of if there is any abnormalities in the content of vitamin D within the body, it can lead to tetany as well. Tetany means your body goes into an involuntary spasm. Okay, the body goes into an involuntary spasm. Large muscles go into an involuntary spasm. It stays in the contracted state and it is not able to relax. That is tetany. Okay, so that can happen because of vitamin D deficiency. There are other functions of vitamin D: protein synthesis, muscle cell growth, improved muscle function. For athletes, most of them who are unaware of the link between vitamin D and muscle strength, it is not only essential for your growth and development, but also to maintain the health of the bone, maintain the health of your muscles. Vitamin D is important. Okay. Yeah, depending on your level of vitamin D deficiency, the physician will recommend which type of supplements are required. Okay. To make sure that the T cell mediated immunity, cell cycle, apoptosis, okay, they all function normally. Vitamin D is required. Adequate amount of vitamin D is required to control the amount of cells that are at apoptosis means what? Cell death. Okay, cells kill themselves so that they don't become carcinogenic or they don't spread infection. Okay, it's a defense mechanism. To control this cell cycle, vitamin D is required. for the prevention of colon cancer, vitamin D is required. For the even for it, there is a link between women who suffer from breast cancer and their vitamin D levels being quite low. Okay, there is an association seen between women who have breast cancer and their vitamin D status is quite low. To prevent prevention of specific kind of cancers, to prevent specific kind of autoimmune diseases, diabetes. Okay, vitamin D is required. Even also to prevent inflammation of bleeding gums because of vitamin C deficiency. It can keep your gums healthy by fighting inflammation. Any periodontal diseases can be reduced by giving 60,000 international units of vitamin D and 500 mg of calcium per day. This kind of diagnosis and treatment is only given by a physician. Just because it is written in the textbook and somebody comes to you with a bleeding gums, you are not supposed to recommend that. You are supposed to recommend them to a physician. Okay. How many units of vitamin D they should get, which type of supplements they should take, how many amount, what is the dose of calcium they should take. These all things are decided by the physician. Now coming to the absorption. Here you can see in your skin, just under your skin, 7-dehydrocholesterol is the inactive form of vitamin D present within all of us, okay? Even in animals. Because of UVB radiation, sunlight, it leads to the formation of active form of vitamin D3, pre-vitamin D3. And again, because of the presence of same heat from the sunlight and the body heat, the vitamin D3, it gets absorbed into the liver, okay? And because of the enzymes present in the liver, CYP2R1, that is one of the enzymes present in the liver, it is converted into 25 hydroxy cholecalciferol, okay? And then it goes to the kidney, another enzyme present in the kidney, CYP27B1. These are the full forms does not matter. You just have to understand there are certain enzymatic reactions going on in these organs, which are converting the form of vitamin D into another. It is transforming the vitamin D into another form. Okay. Finally, you get the hormonal vitamin D, that is 125 dihydroxycholecalciferol. And this has various functions. It helps in the bone health, bone growth, maintenance, mineralization, bone health, immune cells, T cell mediated immunity, cell cycle. Okay, it is controlled by this hormonal vitamin D. Liver cells, it will go to the liver cell again and be deposited there, which can be used for the next 6 months. Vitamin D that is stored in your liver can be utilized for the next 6 months. Okay, if you are under 50, when you cross the age of 50, okay, if you're dealing with an aging population, if you're dealing with senior citizen, they are not able to store vitamin D for this long. Okay, the capacity of storing, your body's capacity of storing vitamin D for about 6 months, okay, that decreases when aging happens. Okay, when you get older and older. And even from diet or supplementation, fish, dairy, fortified foods into the small intestine, and from that vitamin D3 goes into the liver. Okay, it undergoes the same process. So is it clear to all the absorption and metabolism of vitamin D? Coming to the deficiency of vitamin D, see, in absorption and metabolism, two things you have to remember is that there are two metabolism of vitamin D3 taking place. The first one is in the liver, second one is in the kidney. In the first one, it got one hydroxy group. In the second one, it got two hydroxy group. When vitamin D3, cholecalciferol, has two hydroxy group attached to it, it becomes like a hormone. It functions like a hormone. That's the reason why vitamin D is the only vitamin, only nutrient that is considered as a hormone. Okay, it functions like a hormone. It's an enzyme that induces metabolism of vitamin D. You don't have to know about even in the textbook, they have not given the name of these enzymes. It is just available on this image. Okay. So vitamin D deficiency, rickets is seen in kids, osteomalacia is seen in adults. Okay. So it's rickets is a deformity. Bow legs is also another name for rickets. Okay, you can see a normal leg and how ricket, a person who has rickets or a child who has rickets, how their legs become like bow shaped. Okay, their ankles can touch each other, the knees will not touch. Okay, and some other form of severe forms of rickets, the bones can bend in any direction. It's not compulsory. Both the legs should be in bending in the opposite direction. Legs can bend into any direction when it comes to rickets. Okay. Osteomalacia, it's bone softening, a faulty process of bone mineralization. Okay. When you're deficient in vitamin D, the body does not get enough signal, the intestines does not get enough signal of how much calcium that has to be absorbed. Okay, so the mineralization will not be proper, and also the development of bone, if it is in a growing stage, the development of bone will not be proper. About more than 60% of Indians are deficient in vitamin D. The major reason being, we have a lot of colorism practice. Do you understand what do you mean by colorism? It's not racism, it's colorism in India. Do you understand the difference between racism and colorism? Does anyone understand the difference between racism and colorism? In racism, you have a negative bias towards a specific race, okay? An entire ethnicity or a specific race can suffer from a negative bias from the population in general. That is racism. Colorism means you are defaming your own race. Okay, Indians are they belong to one specific race, a South Asian race. Okay, people who have fair complexions are preferred. People who have dark complexions are made fun of. They are not given equal opportunities. Okay, so that is colorism. So because of that, people know that if you go out in sun, you will get tanned. Okay, we Indians are already brown skinned people. If you get tanned, you will get more darker, and you will lose your opportunities. People will make fun of you. People will call you names, etc. Because of all these practices, generally the Indian population, it will, until and unless it is labor workers who do not have any other option, agriculture, farming farmers who do not have any other option apart from going out in the sun and doing their job. Okay, if you are given a choice, majority of the Indians will stay inside the house. They will avoid sun because they don't want to get a suntan. They don't want to get into a deeper complexion, right? So because of this reason as well, majority of Indians are suffering from vitamin D deficiency because we are not getting enough sun. Even when it comes to kids, mothers will not allow their kids to go out and play in the sun because she may say you will get darker. If you go out and play in the sun, you will get darker. Okay, that is colorism. This is one of the reasons why India specifically, Indians, and not just India, but even in other South Asian communities as well, Sri Lanka, Nepal, Bhutan, Pakistan, Bangladesh, okay, the South Asian community in general, we all suffer from the same colorism situation. Okay, this is the social factor that is affecting the vitamin D deficiency, one of the causes of vitamin D deficiency. Even though Indian subcontinent, okay, we get plenty of sunshine, okay, but still, um, majority of the population is deficient in vitamin D. It's not that we live in a European country where you have very less sunshine. Okay, India is a subcontinent where you have a lot of sunshine anywhere in India. Okay, from Jammu Kashmir to Kanyakumari, take any place in India, you get a lot of sunshine. Okay, but even still we suffer from vitamin D deficiency. So rickets is more severe in children between the age of 1 and 3 years of age because they are growing rapidly and their limb bones, their weight-bearing bones have to grow in in that space. Okay, in that space, even the bones have to keep up with the base of the child's growth. Otherwise, it will be stunted growth or bow length. Osteomalacia is usually seen in multiparous women. Multiparous women means women who have given more than two births. Okay, women who have given 3, 4, 5 live births. Okay, they are multiparous women because a lot of calcium is lost from their bones to help the fetus in its growth and even during lactation. And aging also leads to osteoporosis, osteomalacia. Those who do not indulge in physical activity, they have higher tendency to get osteomalacia and osteoporosis early on in life. So risk factors, inadequate exposure to sunlight. People who live in northern latitudes, not in India, but north side of India, they have very long winters and only few hours of daylight. So the exposure to ultraviolet radiation is very less among them. So that could lead to uh, rickets or osteomalacia. Having unrefined cereals, okay, like whole grains, not having white bread at all, even though it is certain communities, they don't use unrefined cereals at all, and whose staple food is coming from refined cereals. Okay, they also develop the risk of rickets. This kind of experiment was done on puppies, not on people. Okay, and it showed that when white bread was in their diet and it was replaced by unrefined oatmeal, the puppies developed rickets. Okay, so some amount of refined cereals are required in the diet. You do not have to completely take away the refined cereals, or like polished rice is a refined cereal. Okay, you don't have to completely take it away. You can add some of the refined cereals here and there in your diet. It will not lead to any major disorders rather than completely avoiding it. But this experiment was done on puppies, not on human beings. Then vegetarianism, those who do not eat no animal food at all, like vegans, okay, they have an increased risk of osteomalacia as compared to non-vegetarians. So the complete exclusion of vitamin D from animal products, it will not lead to rickets, but it will only increase the risk of rickets. Okay. And even vegans, if you're a vegan, it's better you take calcium, vitamin B12, and vitamin D supplements. Then prolonged breastfeeding, when the child is breastfed for more than 3 years, okay, that could lead to vitamin D deficient mother. After 2 years, it is completely normal, 2.5 years of age. When the child is say a 2-year-old or 2.5-year-old, till then breastfeeding is completely normal. But if you prolong that, there are high chances the mother may also become deficient in vitamin D and calcium. Let's speak skin pigmentation. People who have dark skin, they have lower absorption rate of synthesis rate of vitamin D as compared to people who have light skin. Light skin people will need to uh, be under sun for a very few amount of minutes or time. But if somebody is dark skinned, they can be out in sunlight for a little more longer duration, so that enough amount of vitamin D synthesis can take place, because the more melanin you have in your skin tone, okay, the skin becomes more dark, appears more dark, and it may hinder the UV absorption that kickstarts the vitamin D synthesis. Okay, so dark skinned people will require more time out in sun as compared to light skinned people. And it is only a minor risk factor. Okay. Then age, definitely we have seen that as you cross the age of 50, as you cross the age of 50, the rate at which vitamin D is produced and stored in the body reduces drastically. Osteomalacia. So in osteomalacia, if the person is a senior citizen, there are high chances they may suffer from pseudo fractures. Pseudo fractures, they do not have to fall or bend or crack their bones, okay, by their own body's weight, because of the bones are so soft, demineralized, by their body's own weight, the weight bearing bones like the hips, the femur, okay, the joints, knee joints, ankle joints can undergo pseudo fractures without any severe falls. Okay, pain in the lower back, pelvis, and hips. These are the symptoms of osteomalacia. So imbalance of minerals like calcium and phosphorus leads to the decreased ability for the bones to harden. So that leads to softening of the bones. Lack of sun exposure, low vitamin D in the diet, malabsorption of vitamin D because of certain medication. Okay. Taking coffee and vitamin D supplements together, okay, that these things can hinder the vitamin D absorption. Kidney failure, kidney disease or kidney failure, liver failure. How do you diagnose it? You have to take medical history, you have to do the physical examination, bone biopsy, bone densitometry, imaging, X-ray, blood test. So treatment based on your age, based on the dietary changes or supplements are given. For kidney failure patients, medication to balance the mineral and hormone levels both are given. Hormonal replacement therapy also could be given. That is directly 125 dihydroxy cholecalciferol could be given to the patient, injected into the patient. obesity, burns patient, liver disease, renal disease, GI malabsorption disease. These all are the risk factors of osteomalacia and rickets. So you can see here the comparison between a normal bone, osteoporosis bone, and osteomalacia. So in comparison to normal bone and osteomalacia, the bones, you can see the bone matrix. There is nothing wrong with the bone matrix. Bone matrix is intact, but inside where the bones should be mineralized properly, okay, so that is not mineralized properly. It is empty, okay, and there is an accumulation of osteoid. Osteoid means it is immature bone, okay. In osteoporosis, you can see the trabeculae, that is the matrix, it is very thin. There is no connectivity between the bone matrix, and the bone mass is also very low. But in osteomalacia, there is no issues in the connectivity of the matrix. The matrix is there, bone matrix is present, it is intact, but there is no bone mineralization. Okay. So this, you can take a screenshot of this. Recommended amount of sun exposure. Fair-skinned people in 3 different seasons, how long you should be out in the sun. Fair-skinned, medium-skinned, dark-skinned. The darkest skinned people, they need up to 10 times more sun exposure than the fairest skinned, since darker skin absorbs very few UV radiation, but only hardly SPF 7, sun protection factor 5 or 7 is what you get from dark skin, not more than that. And usually for this exposure, this kind of exposure, you're not supposed to wear sunscreen. Is it clear to all? Should I change the slide? UVA radiation can penetrate through glass, but UVB radiation cannot penetrate through glass. If you require sun exposure of more than 1 hour, okay, or 2 hours, it's better to you can use early morning sun rays. After 9 o'clock, 9 a.m. and all in summer seasons, it will become very draining and very dehydrating. In winters, even up to 10, you can expose yourself to sun rays. Evening also it is fine. Try to avoid the peak hours just to avoid dehydration. Okay. If you are using the peak hours, you can reduce the time of exposure by more than half. 10 minutes or 15 minutes of sun exposure in the peak hours is more than enough for Indian skin tones generally. Yes, daily sun exposure. Next, the best sources of vitamin D. red meat, oily fish, egg yolks, tuna, liver, any form of liver, not just beef liver, any form of liver is a good source of vitamin D and vitamin A, salmon, mackerels, tofu that comes in the package, milk that is fortified with vitamin D, yogurt fortified with vitamin D, avocados, broccoli, very few amount of vitamin D you will get from avocado and broccoli. It is not enough. Okay. It is not enough for human consumption. The ergocalciferol present in it is present in avocados and broccoli, but the RDA that you require, okay, recommended daily allowance that a person requires is far more what an avocado or broccoli can provide you. You have to eat maybe kilograms or half a kg or 1 kg of avocado or broccoli to get your RDA met, RDA for vitamin D met. Mushrooms, you can expose the mushroom in sunlight for 10 minutes and then use it. Mushrooms can also produce vitamin D, substantial amount of vitamin D. Before cooking mushrooms, expose the mushroom in sunlight for 10 minutes. Since mushroom is a fungi, soy products that are fortified with vitamin D, when you buy packaged soy products fortified with vitamin D, milk fortified, cheese, cereals have vitamin D, but not to that extent. Shiitake mushroom, expose it to sunlight and then use it. White mushrooms, button mushrooms. Orange juice has ergocalciferol, but not to, it cannot match the recommendation of human RDA. There is nothing called there is no sun, specifically in India. Even in the monsoons, ultraviolet radiations are present. Okay, UVA and UVB radiations are present given any time of the year in India. No, sun exposure in for vegetarians, sun exposure, yes, and using fortified food products and supplementation. That is the best way to meet RDA. But for non-vegetarians, it's sun exposure is required, but active form of vitamin D3 they are already getting from non-vegetarian food. You don't have to depend on sun, non-vegetarians. Coming to the RDA for different age groups, you can take a screenshot of this. We can see the senior citizens, they require the higher supplementation of vitamin D because their body loses the ability to store vitamin D over the period of time. Too much of vitamin D toxicity, hypervitaminosis D, hypervitaminosis D, dizziness, loss of appetite, thirst, headaches, fatigue, nausea. How this can happen when you use the supplements, vitamin D supplements. If you are overusing it, it could lead to hypervitaminosis D. It will not happen overnight. You have to be taking too much of some vitamin D supplements for a specific period of time. Only then the toxicity can happen. This is the assignment.